genetic diversity. Now, as we talk about treatment, we'll see that this already plays an important role in how human subjects respond to therapy. There are 6 major strains of hepatitis C spread throughout the world, known as genotypes. In the United States, genotype 1 predominates, affecting nearly 75% of those infected. Now, among African Americans living in the U.S., that number is nearly 95% with genotype 1. As we'll talk about, genotype 1 does not respond as well to current treatments. Genotype 2 and 3 make up the rest of the infection found in this country and is more responsive. Other countries, such as Egypt, have very high rates of genotype 4. So the genetic diversity plays a big role in how patients respond to treatment. Then within an individual patient, within weeks of infection, the virus mutates and can be found as what's known as a quasi-species, a swarm, if you will, of about 10 or 12 different variants. So this diversity almost certainly leads to chronicity as well as failure to respond to therapy. As I alluded to, this is truly a global problem. WHO estimates there are nearly 400 million persons living worldwide with hepatitis C. Now, in the U.S., this number is estimated to be around 5 million. But if you look at some parts of the world, such as Egypt, which I alluded to, it's estimated between 10 and 15 million people are infected, mostly through an attempt to eradicate schistosomiasis. Persons were infected and needles were reused in this attempt. But throughout the world, hepatitis C remains a very important pathogen. In the U.S., as we'll talk about, the epidemic is now entering its 3rd and 4th decade, and the prevalence of liver disease as a result of hepatitis C is increasing. Now, in the United States, the data come primarily from a study called NHANES. This was a survey of Americans living outside of institutions, so it did not include prisoners or hospitalized patients. From this data, the estimates are 4 million chronically infected persons. There are differences according to ethnicity. Among African Americans, the rates were significantly higher than among Caucasians. So if you took one subset, that is African American men between the age of 30 and 60, the prevalence rate was as many as 1 in 10. If you take a city like Baltimore, where it's estimated about 600,000 people live here, although it shrinks every year, it's estimated as many as 1 in 10 people have hepatitis C, translating to a very major epidemic. When you compare some of these numbers in the United States, 4 to 5 million infected with hepatitis C, to HIV. HIV is certainly a very important disease and one that causes morbidity and mortality. But that number in the U.S. is about 1 million, so 4 times more prevalent than HIV. Now, in looking at how people get hepatitis C, I think it's important to acknowledge that although there are millions of people in the United States with prevalent disease, incident cases of hepatitis C have fallen. Current estimates from the CDC estimate about 30,000 new cases per year, and they are largely attributed to injection drug use. Now, unfortunately, injection drug use remains quite common in the United States, and in fact is increasing in some subsets of the population. Blood transfusion before July 1992 was a major source of infection. Now, in 92, there was the use of an effective antibody to screen the blood supply. More recently, nucleic acid testing has been used, and the current risk of a single unit of blood is less than 1 in a million for transmission of hepatitis C. It can still occur, but the risk is really quite low. So transfusion has fallen as a major source of infection. There's a large area of uncertainty. This, at least in part, because of how these questions are asked. People are given a questionnaire and asked if they have any risk factors for hepatitis C. And it's certainly hard to quantify things like injection drug use. But other risk factors have been discussed with things like tattoo placement or intranasal cocaine use, although it's uncertain how many people are infected through that route. The CDC estimates as many as 15% of persons are infected through sexual transmission. However, there are many data that suggest that it's not very transmissible through this route. In fact, when you look among men who have sex with men or have long-term monogamous partners, hepatitis C transmission appears to be quite rare. So it's uncertain the role of sexual transmission. The CDC, in fact, recommends that discordant couples, where one is hepatitis C positive and the other hepatitis C negative, that condoms or barrier methods are not absolutely necessary. So on one hand, they attribute a number of cases to sexual transmission, but tell individual couples that this is an unlikely route of transmission. And again, this is at least in part due to our inability to tease out risk factors, because couples share more than sex in many cases.